Good morning. As I told you last week, the Department of Public Health has seen a sharp increase in COVID-19 infections in our 15 to 19-year-old age group. Today I want to dig a little bit deeper into what we're seeing in new infections among children and teenagers and let you know how we're going to help our county schools, both public and independent, make decisions to best protect their students' education. Working closely with school districts, our health department has been assembling data points for districts and private schools to use as they work towards a return to in-school education. By the end of the week, we'll be able to share these data points on our websites with all schools. This includes new cases. They'll be shown on our website at stlcorona.com, grouped by zip codes. And this will also show the school districts that are part of those zip codes. We'll also be able to show on our biweekly reports indicator, the next one coming out on Friday, a new case per day indicator. And this will offer expanded case information based on three things. First, new case positivity range and new cases total for age ranges 0 to 5, 5 to 9, 10 to 14, and 15 to 19. We'll also be showing zip code trends for new cases, for all youth cases, and case and contact interview information for school-related cases and school activity-related cases. And these will, of course, help us identify trends in new cases. With school underway in various forms, it's important to make this level of information available to educators across the county so they can make decisions on what the remainder of 2020 will look like for education and also moving into 2021. So far, even with limited school openings, we've seen 75 new cases of COVID-19 in schools. In public schools, where learning is mostly virtual, most of these new cases are associated with staff, 26 staff and 7 students. In our independent schools, where most learning is in person, most of the new cases are associated with students, 39 students and 3 staff members. We've already observed secondary transmission associated with school or school-related activities, and this means one student has passed the virus on to another student. In all, 40 of our county schools have reported either a case of COVID-19 or a close contact of a case of COVID-19, either with a household member or a parent. And these reports are increasing as the month of August moves forward. Reports of school-related cases, along with the high incidence of cases in St. Louis County, almost 200 cases now per day in the county, are concerning. While the rate of new cases among 15 to 19-year-olds continues to increase, the rate of cases among younger students has remained relatively steady. For that reason, we expect to be able to recommend a return to in-school learning for younger students first, but we're not yet ready to make a prediction on what time that will be or offer a timetable. We'll continue reviewing cases and sharing information and data points on our website at stlcorona.com. Any changes made will be made in close communication with our schools. We remain in constant contact with our superintendents as school reopening continues and the new school year progresses, so we can identify challenges, but also understand any changes that need to be made to protect our students or our staff in these unprecedented times. We continue to recommend that everyone in St. Louis County continue to maintain social distancing, wear a mask, and wash your hands frequently. And if you are in close contact with others outside of your household on a regular basis, you should consider having a COVID-19 test. And you can make an appointment for a test through our website at stlcorona.com or call the County Health Department at 314-615-0574. And I would be glad to answer any questions.
Dr. Page, you kind of mentioned, about a month ago at this point, those new restrictions came down. You kind of said, about 4 weeks, we'll see where we are. How are things going? could restrictions be loosening soon? Kind of walk me through that.
So restrictions in general, we're watching very closely as we see across the state that COVID-19 rates are increasing. In St. Louis County, we're holding steady, trending down slightly. We're not yet ready to recommend changing any restrictions on activities in our community, but we're watching this trend very closely. We do believe that the new cases are trending slightly down in St. Louis County. We need to understand what the impact of mixing in our school settings will do to new cases, because we know we will have some gatherings associated with schools, and we need to continue to watch the new admissions in hospitals. Over the past week or so, especially the past few days, we've noticed a trend upwards. So we're not ready to make any changes yet, one way or the other. We're going to hold steady and continue to watch the data and listen to our public health experts. What will happen next, I believe, is that we'll review the data among younger students, where transmission appears to be holding steady. And if we can get those younger students back into an in-school learning opportunity, that will be our next priority.
Is there a number of businesses who were reported and didn't follow some of those restrictions? Is there like a hard relative estimate number of businesses, or did you not have any that were reported?
You know, historically, since the beginning of this pandemic in March, almost all of our businesses have followed our public health recommendations. They really just ask us to tell them what's safe, what's the right thing to do. As I move about St. Louis County, I see the signs up on every door of every business telling people to wear masks. I go in and see people wearing masks almost universally now in St. Louis County, and I believe that's why our infection rate is holding steady and even trending down some in St. Louis County. We are going to watch what happens with schools very closely as we get kids back together. We know we have some student-to-student transmission, especially in the 15 to 19-year-old range, and that's our top concern right now.
Thank you.
Any questions, Doug? Okay, thank you.